Okay, so we're going to spend a few minutes talking about stress and stress management. So first, just a few definitions. Stress is kind of a general term. It can really mean a lot of things. It's a non-specific response of the body to any demand made upon it. So it could be exercise, it could be just the regular daily stressors that we don't even realize a lot of times that we're being exposed to. Um, Eustress, positive stress, getting married, winning the lottery, riding a roller coaster, um, skydiving, things like that. Those are positive stressors. And then negative stress, uh, getting divorced, losing your job. This is what we typically think of as stress, is distress, negative stress. So the difference between eustress and distress, if you're skydiving, skydiving is eustress. When you pull the cord and the parachute doesn't open, that's distress. All right. Some of the stressors, factors with the potential to cause stress. So, usually when I'm in a classroom, I'll ask students, what are some of the things that stress you out? And they'll give a whole list. Things like school, tests, relationships, parents, money, job, work, whatever, girlfriend, boyfriend. So, these things are stressors, factors with the potential to cause stress. Um, Again, the underlying word there is potential because not everybody is going to react to a stressor in the same way. A good example, if you're sitting in a traffic jam, some people are going to be pounding on the steering wheel, flipping out, cursing at people, and then other people are just going to be sit back, relax, reading a book or a magazine or a newspaper, and just not really affected by it. So uh, the thing is, regardless of that source of the stress, that physiological reaction is the same, and we're going to talk about that physiological reaction um, with a little bit more detail. These are some of the ratings. Death of a child. These ratings don't really mean anything. I don't even remember where I got this source from. So, but these are typically the things that are considered to be some of the more stressful things that people encounter on a regular basis. What is not up here and should be is going to war. Any type of active duty should probably be one of the first things up here. But uh, again, maybe that should be under here. Soldier. I don't know why soldier isn't up here. But some of them were. Again, this list doesn't really mean anything, but it's what is normally cited as some of the more stressful jobs out there. Perfusionist, by the way, is it's actually a very good job. I think they have a graduate degree, a master's degree. They run the heart lung machine during surgery. So if the problem is if they screw up, then the patient dies. So it's a pretty stressful job, but it's a very well-paying job if you can handle stress. And the rest, you can put almost anything up here. Waitress, nurse should certainly be up here. So any job, a lot of jobs probably should be up here. Um, your The food that you eat can actually create a stress-like response. Believe it or not. So obviously things like caffeine are going to affect you. Too much sugar, too much nicotine is bad for you. Probably any nicotine actually. Um, Processed flour, white flour. Again, too much chocolate. Uh, so just be careful about what you eat. And then if you see the supplements that are called stress formulas, um, what happens is when you're undergoing a lot of stress, your body is depleted of certain vitamins, and there's the B complex vitamins, C, A. So the stress formulas, they really just contain high amounts of those vitamins. I don't know that they actually do anything to prevent stress. Um, the general adaptation syndrome. I never learned how to pronounce this guy's name. Dr. Hans Seil, maybe, I don't know. He came up with this quite a long time ago, and the idea is that all organisms have a similar response when confronted with a threat to their well-being. So it's important to remember, especially back in this time. I mean, this is probably 60 or 70 years ago. Um, when scientists were studying this kind of stuff in humans, they were almost always studying men. So there are probably some different, slightly different responses in women. Um, we'll talk about those at another point, but women still undergo the same response. It's probably just a little bit different than the way men do it. So it's that fight or flight response again that we saw in those videos with Robert Sapolsky. That animal instinct when you're confronted with a threat, you're either going to run or you're going to fight that threat. Um, and then the stage of resistance, chronic stress, is that that threat never really goes away, or that perceived threat never goes away, and the body is constantly maintained in that state of readiness until you hit the stage of exhaustion when you just burn out. The threat is not eliminated. Sorry, that's a typo. The threat is not eliminated, and eventually you get diseased or you get sick. And we'll talk about some of the different ways that you can get sick. Um, Again, that fight or flight response, we saw this. Just think about the that zebra trying to get away. Um, so, your blood pressure is going to go up, your muscles are going to contract, cholesterol is going to go up, your heart rate is going to increase, you're going to get increased mental activity, hydrochloric acid is going to be secreted, your abdominal arteries are going to constrict. So, we need this without a doubt. We need the fight or flight response. The problem is that when that threat or the perceived threat is not eliminated, and this just continues, you start to develop blood pressure issues. You start to develop what we call bracing, is when your muscles contract so much that you start to develop muscle pain, muscular pain. You develop cholesterol issues, heart issues. You get headaches, migraines. The hydrochloric acid settles in your stomach, and you get abdominal issues, digestive issues. So there's all sorts of issues that can occur when we're not properly managing stress. And a big part of the problem here is that, the stressors that we're facing, whether it's a traffic jam or, work stressors, we're sitting in an office for 8 hours a day, some of us anyway, sitting in an office for 8 hours a day. That's very unnatural environment, to be honest with you. And it's, you're not walking around and getting exercise the way that, or regular physical activity the way that we should, and we're sitting behind a computer for 8 or 10 hours a day. So the stressors are much different than what our ancestors faced. Yet we're still having that fight or flight response trigger, and we need to figure out a way to separate out these current sociological stressors from and psychological stressors from that what is essentially a physiological reaction. Um, So again, when we're not successful doing that, unfortunately, we can get diseased. So just like there's no magic bullet, there's probably no one single underlying cause for disease. So it's a combination of things. It's usually stress and a poor diet and a lack of exercise, but stress can certainly have an impact on every one of these things. Um, and it's important to note here that job dissatisfaction is actually cited as one of the leading, maybe the leading predictor of cardiovascular disease. So, stress, again, obviously, we talked about cardiovascular disease, high blood pressure, even cancer. It increases your likelihood of getting cancer, irritable bowel syndrome or colitis, depression, anxiety, insomnia, fatigue, pain, allergies, and asthma can all be influenced by stress. What we used to call it impotence, now they call it erectile dysfunction or sexual dysfunction, because it could be in men or women. Rashes, ulcers, increases risk of self-medication, so alcohol usage or other usage of other drugs, headaches, migraines, hormonal issues, PMS. So all these things can be at least stress can at least contribute to these things. One estimate is that about 90% of doctors' visits are either rooted in stress or affected by stress. So rumination, something that we've all done, and I'm going to talk a little bit more about this in another presentation, but it's when we think we cannot let go of something. Essentially, we're either obsessing about it or we're fixated when something negative that happened to us in the past, whether it was an inappropriate comment that somebody made, something relatively minor, all the way up to something more serious, where we're talking about post-traumatic stress disorder, and somebody that just cannot get over something that unpleasant or completely inappropriate, something that happened to them a long time ago, or something more recent. So just identifying or realizing what rumination is really the first step in countering it. When you're caught in your mind thinking about something negative, you just realize, look, listen, I'm caught in the rumination right now, and I need to quit it. I need to shut it off. So we need to learn how to, shut off the negative thoughts in our brains and try to promote positive thinking as much as possible. And you can train your mind to do that. And that is essentially kind of the end point in stress management. We'll talk about this a little bit more. And it's not just about controlling negative thoughts, but promoting positive psychology. Um, so as far as the central nervous system is concerned, I'm sure you've seen this if you've had a psychology class or even a biology class. Um, the central nervous system is split up into the sympathetic nervous system and the parasympathetic nervous system. And what most of us have, especially in our culture, is kind of an imbalance towards the sympathetic nervous system, in that we're a little bit too stressed out. Essentially, is what it is. And a lot of alternative medical techniques are really just about trying to trigger that parasympathetic response, the relaxation response. Whether you're talking about massage, meditation, herbs like chamomile, St. John's wort maybe might help with this, but um, acupuncture is known to trigger the parasympathetic response. Yoga, obviously, is a big part of this. So it's not that we want to be overly parasympathetic, but again, the problem is most of us are overly sympathetic, and we need to um, balance that out a little bit more. And in Japan, that imbalance is actually a routine diagnosis. The automatic nervous system imbalance is something that they will diagnose and then make recommendations to treat. They won't necessarily just use pharmaceutical interventions. They will when they're appropriate, but they will prescribe. They're more likely to prescribe diet or exercise to help balance that out. So, again, in the U.S., this imbalance is not really diagnosed, but generally, again, we treat the branch rather than the root. We use pharmacology to suppress the symptoms of this imbalance. Um, so the relaxation response, very important in stress management, very important in, I guess, alternative medicine. People who use relaxation techniques, and we'll talk about a whole variety of these when we talk about mind-body medicine, um, they have lower levels of stress chemicals in their body. This is actually measurable. They seem to be much better at handling stress. In the extra credit assignment, I posted a movie, I forget what it's called, it's something about mindfulness, the science of mindfulness. And I would highly recommend that you check that movie out, even if you don't want to do the whole write up for the extra credit. But relaxation can be induced through a whole variety of means, and take your pick, whatever you feel comfortable with. When meditation really, it has been a spiritual practice in the past, but a lot of health practices were handed down through spiritual leaders, because not all the times, but a lot of times, the spiritual leaders were the ones that were literate. They were the ones that were educated. Again, this is kind of a generalization, but especially in Europe. So a lot of health practices came from that group. So it kind of makes sense that meditation would come from that group, or recommendations about meditation would come from that group, and they're very profound, have very profound health implications from the research that's been going on, not just in treatment of disease, but in actually preventing disease. So what we consider now is that meditation is considered to be an exercise, a mental exercise. And again, we're going to talk a little bit more about this. Coping, and I got this from a really cool website. It's called Nursing Theories. I would recommend that you check this out. It's a balancing act between biological, psychological, and social processes. So, in other words, when you're faced with a lot of stressors, do you have positive coping mechanisms, or what we refer to as adaptive coping? And I posted some in our reading assignment. There's some information there about positive coping strategies. So I would ask that you please check that out if you haven't already. And then maladaptive coping, alcohol usage, things like that. Anger, anxiety. All these things fall under the maladaptive coping strategies. And Obviously what we want to try and do is control the maladaptive coping strategies, which I think we all use from time to time, and promote more of the adaptive coping. And that again, that article will kind of talk about that. It's mostly about optimism, and I have a whole nother presentation on that. So again, we'll talk more about that. So this is the main point, and please take note of this first paragraph especially, and write this down, highlight this. This is the main point of this whole presentation here. The primary goal of stress management is to separate out that fight or flight response from our everyday stressors, from which we really get no benefit from that fight or flight response. We accomplish this by altering our perception of these stressors. So we kind of reprioritize how we allow things to affect us. So it's about, when you're getting stuck in a traffic jam, is it really worth making yourself sick just because you're going to run a few minutes late? You call your boss and say, "Look, I'm stuck in traffic." That's it. Is it really worth making yourself sick over the silly little things that we encounter every day? Whether somebody said something inappropriate about you or to you, or somebody cut you off in traffic, like who cares? Really, is it really worth elevating your risk for cardiovascular disease because some jerk said something inappropriate to you? Probably not. All right. So until we're really successful at really controlling our response, and it takes time. It's a training. You don't run out the first time you go when you want to start a new exercise program. You don't go out and run 10 miles the first time. It's a gradual process. Okay. And it takes time until you're really able to control that. Make attempts to minimize unnecessary stressors. Please read through again that Harvard posting that I posted for these time management or the stress management techniques. It's a wonderful article. It's nice and brief. It goes through time management strategies. It talks about procrastination, which is a big. Which again is something we're all guilty of, probably me more than most. But procrastination really elevates stress levels over time. So please again read through that Harvard uh, article as well. Um, there's this idea of neuroplasticity. And again, we're going to talk a little bit more about this when we talk about mind body medicine. But it's the idea that our brains can change. And just because something stresses you out doesn't necessarily mean that it has to continue to stress you out. You can learn how to respond to those stressors. And again, the brain is not hardwired. Our brains are malleable. And we can relearn how to respond to common stressors. And again, that's a quote directly from that video that we watched, the 90-10 video. So, pardon me, kind of wrapping up here, we're comparing stress management now to the Buddhist psychology. And in the normal 16-week section of this course, I have my students read this, at least part of this book. I will do a presentation on this. The 6 weeks just isn't enough to read this book, enough time to read this book, but I will cover this. Most of what we know about stress management really comes out of Eastern philosophy or Eastern psychology, I guess I should say. Buddhism isn't really a form of religion; it's really more a form of psychology. And the main goal between stress management is pretty much the same thing as Buddhism. Stress management just uses a more scientific terminology. So we alter our perception of our stressors to reduce or eliminate distress, versus in Buddhism we alter our perception of reality to reduce or eliminate suffering. It's really the same thing. And really, ultimately, stress management becomes an attempt to eliminate all negative thoughts and promote positive thinking as much as possible. Because with positive thinking is going to have a profound impact on your health. Again, we're going to talk about that more when we talk about mind body medicine and the science of psychoneuroimmunology, how our thoughts and our feelings and our emotions affect our immune system. Not just our immune system, but our cardiovascular system, our nervous system, etc. Okay, so we'll talk more about this link again. Okay, so I hope this was enjoyable and informative. Take care.